was thinking about this question, I sort of read it as a game of two halves. Being into asset-based approaches, I'd like to start with the positives. So, as a couple of people have said, what's positive for me is about recognising addiction as a public health issue, rather than as the media would have you believe a problem that other people have. You know, the irresponsible binge drinker, the violent thug, morally corrupt, the homeless loser. And I really hope this signals the beginning of a debate that sees some of the key health issues we challenge, that we face, as less about individual failure, it's my fault, and more as a result of the social, economic and cultural challenges that we're facing at the moment. I guess it's starting to see addiction as a symptom rather than the cause in itself. And I think that once we start to see addiction as a logical response to issues like social isolation, economic marginalisation and overwhelming stress and uncertainty, we begin to take that debate away from moral failure and recognise the sort of underlying factors that are key. And unless we tackle these factors, then escaping our circumstances through things like drinks, drug, food, gambling will continue to be logical. And I suppose, underlying this all is that I have hopes that Public Health England could be key in promoting a fifth wave of public health. For those of you who are not familiar with this thinking, Professor Phil Hanlon and his colleagues suggest there's been 4 waves of public health. And the first one, and Mark's talked about this, is the sort of the provision of things like clean water in urban areas, so health becoming a public health issue. And wave 2 was the sort of 19th to the mid-20th century, where medicine became a science and modern technology gave rise to hospitals. And sort of the concept of the medical expert was born. Wave 3 was the end of World War II, which saw great social change and then the welfare state coming into being. And the 4th wave, I suppose, is the mid-20th century onwards, which has been dominated by efforts to combat disease risk. And also health has become an agenda for policymakers in all sectors, and people are aware of health being a key issue. But Hanlon and his colleagues suggest that a 5th wave is necessary as a means to address issues such as social inequality, loss of well-being, so things like rising depression and anxiety, and issues like obesity. And as someone who suffered anxiety, alcohol was quite a logical response to that. It didn't turn out to be a logical response, but at the time it was, and I think that's where I'm getting the illogical idea. So we need basically to see a shift where we reward healthy behaviours and create social and institutional environments that encourage healthy choices. And we need to talk more about the health consequences of people's choices, and we need to minimise the influences to unhealthy behaviour. So some of this is tackling the overwhelming strength of things like the alcohol lobby. So for my positives, I think shifting the conversation to an approach to dealing with issues like addiction as a public health issue could be hugely positive. But, and it's a very big but, I'm massively concerned that PHE, sorry Mark, is ultimately a bit toothless when it comes to influencing delivery on the ground. If you look at PHE's responsibilities, there's a lot of use of words like encouraging, supporting and helping. But I'm really concerned that the ultimate decision-making over what services are commissioned takes place at a local level, which currently is based much more on financial and political concerns rather than a public health agenda. So if addiction is one of a number of priorities, and a pretty unpopular priority at that, and you add the fact that there's a massive reduced funding envelope, we're in dangerous waters. We're already seeing successful services closing, and in other areas re-tendered in really rapid process with a reduction around 50% of funding. And I'm really worried that before we even get to this wonderful long term and this wonderful 5th wave, the services that initiate recovery and introduce concepts such as well-being will be seriously limited in what they can do. And we'll end up returning to that short-term thinking that treats symptoms rather than causes. So my answer to the question is yes and no. With my aspirational hat on, it's a great thing for public health, for services to sit under public health. And with my realism hat on, no. I want to stress though that I did come at this question as a previous recipient of services and someone who does a great deal of recovery stuff on the ground. And I'm sure I could be accused in some cases of not really understanding the political and economic complexities of this area. But for me, that's the issue. I find the message is very confusing, and the complexity excludes people from the debate, and there's confusion about where responsibility lies. And I'm not really sure that's good for anybody's health.